Did you know that lung cancer doesn't only affect smokers? In fact, about 20% of lung cancer patients have never smoked a day in their lives. It's crucial to understand that anyone can face this challenge. Environmental factors, genetic predispositions, and even secondhand smoking plays a significant role. As we become more aware, we can foster compassion toward those affected. I want you to know that nearly 90% of people ignore the early warning signs of this disease. Well, I'm here to change that. In the next few minutes, we're going to discuss the often ignored signs of lung cancer that could help save your life or the life of someone you love. I want to talk about the signs you shouldn't ignore. These are the signs that could make all the difference. Because let's face it, many of us don't think lung cancer could happen to us until it does. So whether we've experienced it directly or know someone who has, its impact is profound. So let's dive into this together. 1. Shoulder or arm pain. Shoulder or arm pain is something most of us experience at some point in life. It could be from an injury, poor posture, or even stress. But what if I told you that sometimes this pain could point to something more serious? You see, our bodies communicate with us in many ways. Pain, discomfort, or unusual sensations can be your body's way of signaling that something's wrong. In some cases, that something might be lung cancer, a disease that often goes undetected until it's in advanced stages. Let's break it down. Lung cancer may not directly cause shoulder or arm pain, but here's where things get interesting. The thoracic nerves, which stem from the spinal cord, serve both the lungs and the upper limbs. If a tumor develops in the lungs, it can irritate these nerves, leading to referred pain in the shoulder or arm. This type of pain is often termed referred pain. It occurs when the brain misinterprets where the pain is coming from. While not everyone with shoulder or arm pain has lung cancer, it's crucial to recognize the other symptoms that could accompany it. Common symptoms of lung cancer can include persistent coughing, unexplained weight loss, chest pain, or even shortness of breath. If you experience these along with shoulder or arm pain, it's essential to consult a healthcare professional. Early detection plays a vital role in improving outcomes. Now let's take a quick moment to emphasize, not all shoulder or arm pain is a sign of lung cancer. Life is complex and many factors can lead to discomfort in these areas. It could be something as simple as a muscle strain or an overuse injury from that new workout routine you've been trying. But here's the takeaway. Listen to your body. If something feels off or unusual, don't hesitate to reach out to a healthcare provider. Your health is paramount, and seeking help is a sign of strength, not weakness. 2. Keratin patches on fingernails. Let's talk about fingernails. Yes, those seemingly innocent patches of keratin at the tips of our fingers, and how changes in their appearance could be a sign of something more serious, lung cancer. Before we jump into the specifics, let's quickly establish why this matters. Lung cancer is one of the deadliest forms of cancer worldwide, and early detection is crucial in improving survival rates. While we often think of symptoms like coughing or chest pain, many people overlook subtle indicators that can show up right at our fingertips. Let's start with the basic anatomy of a fingernail. Did you know that our nails can actually reveal a lot about our overall health? Changes in color, texture, and growth patterns can indicate an underlying issue. For instance, if you notice your nails becoming clubbed, meaning they widen and curve downwards, that can sometimes signify a condition affecting your lungs or heart. This happens because when the lungs aren't functioning properly, the body may struggle to get enough oxygen, causing those changes in your nails. Now, clubbing isn't the only thing to watch for. Discoloration can also be a red flag. Nails that take on a bluish tint may suggest that your body is struggling with oxygenation, which is typical in lung diseases, including lung cancer. Let's talk about texture. If your nails become more brittle and start to break easily, or develop deep ridges, that could indicate an issue too, particularly if it's coupled with respiratory symptoms. Of course, many factors can affect nail health, but in the presence of other signs, it can become a cause for concern. Nail changes are often overlooked, but they can provide vital clues to a person's health. If someone experiences significant changes in their nails, particularly alongside other lung-related symptoms, I always recommend a thorough checkup. 3. Difficulty swallowing. Difficulty swallowing or dysphagia can be caused by so many factors, everything from anxiety to gastrointestinal issues. But it's crucial that we sometimes take a closer look because it could be a red flag. When it comes to lung cancer, a persistent sore throat or swollen lymph nodes can lead to complications that make it hard to swallow. This is your body's way of signaling that something might be wrong. So let's break down this connection. Lung cancer, as many of us know, can manifest in various ways, and it doesn't always start with the classic symptoms like a persistent cough or chest pain. Studies show that when lung cancer spreads, it can affect nearby areas, including the esophagus, which is responsible for transporting food from your mouth to your stomach. This pressure or invasion can lead to swallowing difficulties. If you've been experiencing difficulty swallowing, especially combined with other symptoms like unexplained weight loss, persistent cough, or chest pain, it's essential to consult a healthcare professional. Remember, only they can provide a proper diagnosis, so don't wait. Take action. 4. Eye problems. Let's talk about the anatomy of the eye. It's not just for vision, it's linked to various systems in our body. For example, certain changes in the eyes might indicate a problem with circulation, which can be linked to lung health. But how do the two actually connect? Here are a few eye symptoms that you might not realize could be linked to lung cancer. 1. Yellowing of the eyes. You might notice a yellow hue in the whites of your eyes. This could indicate jaundice, which sometimes hints at underlying issues like liver problems or lung cancer. 2. Vision changes. Blurred vision or sudden changes in eyesight can potentially be symptomatic of systemic conditions affecting your lungs. 3. Drooping eyelids. Also known as ptosis, this could signal neurological issues, often related to diseases that might affect lung functions. Now, I'm not saying you should panic every time you notice something different with your eyes, but it's crucial to understand that these symptoms can be precursors to more serious illnesses. 5. Swelling around the neck. Let's discuss what swelling in the neck actually is. It's usually a sign that something is happening beneath the surface, whether it's an infection, a cyst, enlarged lymph nodes, or even an allergic reaction. But in certain cases, it can be a warning sign for something more serious, such as lung cancer, particularly when there's metastasis involved. Lung cancer can spread to other parts of the body, including lymph nodes in the neck. When this happens, swelling can occur, and this vital sign is often overlooked. Now, you might be wondering what other signs you should be looking out for. Typical symptoms of lung cancer can include persistent coughs, chest pain, and shortness of breath. But when it comes to signs that might involve the neck, look for these key indicators: swelling of lymph nodes, pain around the collarbone, or a noticeable change in the appearance of your neck. The lymphatic system plays a crucial role in the body's immune response, and when cancer spreads, it might be one of the first indicators that something is wrong. So what can you do if you notice swelling in your neck? First and foremost, don't ignore it. I urge you to visit your healthcare provider. An early diagnosis is vital, especially if there's a possibility of lung cancer being the root cause. Schedule a medical examination, get imaging done if required, and advocate for yourself. Sometimes it's easy to brush off health concerns, but taking that initiative can be life-saving. 6. Persistent infections. Persistent infections like bronchitis or pneumonia are often dismissed as common ailments. They come and go, leaving us feeling drained, but ultimately, we usually brush them off. However, what if I told you that these repeated infections could be a red flag, a warning sign of something much more serious, like lung cancer? Yes, you heard that right. So what's happening in the lungs? Our immune system is tasked with defending our body against pathogens. However, when lung cancer decides to take hold, it can compromise our immune defenses, making us more susceptible to persistent infections. According to Dr. Omar Khan, an oncologist with extensive experience, persistent infections can sometimes be among the first indicators of lung cancer. The underlying tumor may be creating a hostile environment, leading to these repeated respiratory issues. Now, I want to share with you some key symptoms to watch for if you or someone you know is experiencing 1. Continuous coughing, especially if there's blood. 2. Unexplained weight loss. 3. Difficulty breathing or wheezing. 4. Chronic fatigue that doesn't improve. It's crucial to seek medical advice. Early detection is vital, and if there's a chance we can catch something early, we need to take that chance. As we wrap up today's discussion, I want to say this. It's essential to cherish every moment, to advocate for regular checkups, and to support one another. If you have a loved one facing lung cancer, remind them they're not alone. We all have the power to make a difference. be it through raising awareness, fundraising, or simply being there for someone in need. So let's continue this conversation. Share your stories, drop a comment, and let's build a community of support and understanding. Don't forget to like and subscribe for more crucial topics like this one. Together, we can fight lung cancer and offer hope to those in need.